So thank you very much for your interest and attendance today. We're going to talk about school closings. That is a big topic right now. If you look at, and the topics, coronavirus, should we close the schools? If you look at the rest of the world, a lot of countries are closing schools, and it happens to be the countries that have been hardest hit: China, Italy, Japan, Spain in significant regions, Iran. I couldn't find anything on Iran. I think they've closed schools, I'm pretty sure. We've got a few viewers from Iran. I'd love for you to let me know. We've got somebody from Spain. I'd love for you to help us out there as well. And South Korea. And if you look at the world map, again, that happens to correspond with the countries that have the most experience with this disease: China, Italy, Iran, Korea, Spain, France, Germany. I don't know if France and Germany have closed schools or not, but it's an interesting difference in this picture. If you look back at the picture of the outbreak just 2 weeks ago, it was centered on China. Everything was in China. Now look at it. That's not the case anymore. A huge growth in Europe, tiny specks in Africa and South America. North America's in major growth mode right now. So there's two positions that are very obvious. Maybe there's some positions in the middle, and actually there are. For example, the Washington, I think Seattle schools actually closed travel events, extracurricular events, but not the schools. But we'll get to that in just a minute. We'll go through the New York position, which is don't close, keep the schools open. We'll go through the Washington State position, which is go ahead and close. And I'm maybe over speaking. I'm not speaking obviously for either of these jurisdictions, but I'm labeling them that way because you'll see why as we go through this video. So Richard Carranza, the chancellor of the New York City School, said, only as a last resort, 70% of students in New York City rely on free lunches. 30 million in the US rely on free lunches. 114,000 students are homeless in New York City. So the schools provide a huge component of stability to their life. That's true for 1.36 million students in the United States. More on the don't close side. Lots of families are left scrambling. That's a quote from Aaron Pallas, at Columbia Teachers College. There's a long-term impact for kids on their learning, and you'll see that several places, several times. You'll continue to see that repeated. Now, how are parents going to take? What are parents going to do? Who'll watch the kids? A third of parents in the private sector don't have paid sick days, so they're losing income if the schools close. 70% of low-wage workers lack paid sick days. So the people that this will hit the hardest have the least, it's going to hit them the hardest. It's going to compound because they get the least income. And yet, even though they may be on a just barely scraping by, they're the least likely to have any kind of benefit if they have to leave home to take care of the kids. So as you go through that logic, you begin to realize that we may be, a major portion of this may be closing the schools to help. Yes, we know that kids are not going to be that much impacted, but we want to contain the spread. And guess what? We're going to be taking the kids and putting them with the grandparents that we're trying to protect. Because if we're closing the schools to slow down the spread, what we're really trying to do is protect the grandparents who we're now going to put the kids with. More on the don't close side. I had an interesting conversation with a colleague of mine. He used to run a vaccination program for kids for one of the big pharma, and he felt very comfortable in his opinions. He said, look, they're overdoing it. This disease does not hurt the kids. The press is overhyping this for ulterior motives. And I have to stop and react to a couple of these things. The press is not overhyping this. The public health officials are being pretty clear and adamant that this is a big deal. And he said it's not that serious. There's a lower mortality rate, so it's really like the flu, seasonal flu. And he was referring to some of the numbers that came out, the mortality numbers that have been coming out of South Korea. I'll just make a quick parenthetical comment. I hope to cover the mortality rate and how it's doing like this in another video. But here's the thing: as an experienced epidemiologist, the mortality rates always drop, and there's several reasons. There's a great video on the technical reasons for it from Johns Hopkins. Again, I hope to do a video on it over the next couple of days. The biggest thing, though, is it usually drops. And here's why. It's, the folks from Hopkins brag about denominator medicine. And here's the thing. When a disease like this first gets recognized, you're only finding the deaths. All the other people that had mild cases of it never recognized it, never reported it. So you're not getting the denominator for the mortality rate. You're getting the death rate, but then the denominator, the number under that, the number of sick but not dying, is very, very underestimated. That's changing. And in fact, for those of you who heard that South Korea now indicates a 0.6 mortality rate, not 2%, not 4%. 0.6 begins to sound like, well, it's still not seasonal flu. That's 0.1, 0.3, 0.2, 0.05. So it's still what? 5 to 10 times the mortality rate of a seasonal flu. So it still looks like a big deal. Back to the don't close the schools position. The long-term effects of lost learning time. Again, I said you're going to hear that over and over and over again. This impacts our kids' abilities to learn. Then some people go back. I think the New York Times did this in one of their articles. In 2009, they closed for H1N1, and then they reopened 3 days later because they discovered H1N1 was not that serious either. So they're saying, look, let's learn a lesson from the past. These things are not that serious. As soon as we close them, we're going to reopen it and look like fools. And they also said, kids spread seasonal flu, not this. I don't know where they're getting that evidence. It's very interesting. At some point, I would really like to investigate that further. I did not, I've heard this several times from the people that say don't close schools, that kids don't spread this flu. Again, I'd love to have comments. Again, I know we've got people that live in a bunch of other parts of the world, places hard hit like Iran. Is it true that kids don't spread this? You guys aren't seeing that? More on don't close. Michael Osterholm said, Director of Infectious Disease. He's the Director of Infectious Disease at Disease Research at University of Minnesota. And he said, well, I'm 1 foot deeper in the don't close side. And some of the reasons he mentioned were, there's no evidence it will stop the spread. Again, I got to stop. We congregate kids 8 hours a day in these mass environments, and there's no evidence it'll stop the spread. This is transmitted like the flu. And he's the Director of Infectious Disease Research at Minnesota. I'm sorry, my head's starting to hurt. Seattle district officials, there were over 15 people had already died in that Seattle district. 30,000 had signed a petition to close the schools. It's change.org petition. They didn't. Why did they not close the schools after 15 people had died? Well, the Seattle and King County public health officials said, children don't get sick. And even if we close the schools, they're going to congregate at the local McDonald's, rallies, the local fast food place, wherever the kids congregate. So it makes no difference. They're going to congregate anyway. So now let's look at the other side of this issue. Close the schools. And I'm labeling that the state of California side. You'll see why in a minute I'm labeling it that way. So if you go back and you look at the rest of the world, 300 million students have been shut out of their schools. 13 different countries, K through 12. US colleges and universities are starting to close, and they're saying, look, we're going to take our classes online for the indefinite future, which I think, I think that's a great idea. I've made the request to take some of our church online. Not getting a lot of takers yet. The Lake Washington petition that I mentioned a few minutes ago is part of, they stated this. They said, don't put parents in the position of education versus health for their kids and their families. And here's where it came from. I can't find the exact group. I think it was the California State Board of Schools. They said, look, we're issuing guidance, and here's the guidance. Close your school if there's one student, one staff, or one teacher that's found to have the disease. Now, they didn't say close the school if there's a parent with the disease. I'll talk about that one in just a second. California, the second part of the California State Board of Education advice was warn the families against kids congregating, because we know they'll do that, and just keep an eye on them and don't let them do it. Now, I mentioned close the schools. Should you close the school if a parent has it? I think it was Williamson County, Tennessee, had just that situation, and I believe they closed the school. So now we're getting into discussions about, should we close the whole district or just close one school? And again, it's a challenging mess right now. Elk Grove, California, is closed for at least a week, as well as a lot of others. So a lot of closures, a lot of debate on this issue. Now let's go back to New York. Despite being the poster child for saying, we're not going to close our schools, it's going to be too much of a negative impact, Scarsdale closed their public schools March 18th. New Rochelle closed their schools. Albany closed their schools. The National Guard has been called out to help, and I believe it was called out for the New Rochelle outbreak. That was where, I think that was where one lawyer is supposed to have infected, what, 30 people, 50 people, something like that. Somebody fact check me on that. So, and again, you see the headline, coronavirus updates, suburban New York to enact containment area, closed schools, and US tops 1,000 confirmed cases. So what do you think? You think we ought to be closing schools? And if so, when? If you close one school, should you close others in the district? If you close a school, should we just close it now? Or should we wait till there's a one case, two cases? I've seen other ones that said, no, close at least 1%. I've seen other places say close at 10%. If you close at 10%, the cat's out of the bag. And I'm guessing if you close at 1%, at least half of that cat's out of the bag. Should you close if one of the students' parents is sick, like I think has happened in Tennessee? So a lot of good questions. I'd love to hear your thoughts and input. And when I'm with patients, I don't try to make decisions for patients. I try to inform patients and then let them make a decision. As they're going through that, one of the key things that they do is they say, okay, doc, you've informed me of what you know. I know what I know. What decision would you do if you were me? So what do I think? I think it's pretty clear. I think it's pay me now or pay later. The other countries that have experience with this have learned the hard way. Is that what we want to do? So thank you very much for your interest. I'm going to see if we've actually got some folks here. We were bragging, talking about having our technology up and running. And then all of a sudden, something disappeared, which is just so classic for managing this. Okay, great. So this is crazy. Kathytopia. Bob, how old was your, Bob Weiss came on before the meeting and he said, look, he lives in the North Georgia mountains and he's got a friend there. He advised his friend to get his numbers, get his I think you were talking about your inflammation panel, insulin resistance, find out what's going on with him. The friend declined to do that. And the friend had a heart attack. He died 3 days ago. I'm sorry to hear about your friend, Bob. I really appreciate you sharing that. And guess what? I see that all the time. I made the choice in my retirement to put a position out to help people prevent disease. And people aren't really geared to think about prevention very well. So, have faith. Good morning, all. Needed to stop international travel. I know people still going on trips. That's the truth. And guess what? They're still going on cruises. And after the episodes that we've seen with the cruise ships, are you beginning to get the perspective that these are sort of like giant human floating petri dishes? I hate it. Actually, we have not one, but 2 cruises that we've purchased. We had one in China for right now. We were supposed to be in China. In fact, we were supposed to be in Wuhan, China. We had, it was a 2 or 3 week trip, and the major part of it was going to be a cruise. As you can see, I'm not in China. We still have a couple of others set up. One in, I can't remember the name of the river in Portugal, and another one to go down the Danube. I wonder if we're going to make it to either one. The upside to those is that those are small riverboat cruises, and they're not like these multi-thousand people on a giant area. But I'm worried right now. They aren't set up till October and next year. Hopefully we'll have this thing under a better control by that point. Bart Robinson, thanks for keeping us updated on everything, Dr. Brewer. Well, thank you, Bart, for your interest. Kathytopia, the kids don't seem to be dying from the virus. They do. They do not seem to be dying, and they do have an immune system this virus is not impacting. The position that it's not hurting the kids is accurate. The major reason to close the schools, if we do that, is to protect the old people. Just like the tens of thousands of people that attended athletic, basketball games and other concerts, other events last Saturday, most of those people are not going to die even if they do catch it, and they did amplify transmission with those meetings. But they're going to take the virus home to their grandparents and kill them. Lisa Grados, only 3% of infected can get complications. No, I'm sorry, that was Lewis. So Lewis, let me give you some numbers. 8 to 10% of SARS, the last coronavirus, died. 32 to 36% of MERS died. And it could be anywhere from 0.6% to 3 or 4% for this virus. Now, so this virus is much less lethal. But let's do a comparison on the other side. Let's look at Spanish flu. 1918, although it was labeled Spanish flu, it actually appears to have started in America. The fatality rate for Spanish flu appears to be in the area of 2%. Again, much lower than SARS or MERS. SARS killed, what, a couple of thousand, MERS killed a few hundred. Spanish flu, at a mortality rate a fraction of the others, killed 50 to 100 million. Now, why are the diseases with the lower mortality rates killing more people? Well, it might be because you get infected. It doesn't really do that much to your body. You don't have symptoms. You, in fact, go without symptoms for a few days or mild symptoms. Meanwhile, you're spreading it, you're sharing it. It has to do with what we call R naught, the number of people that you're likely to spread that to. If you have a disease that's very fatal very quickly, it's going to kill people. It's going to be very, what we call virulent, virulent. In other words, you get sick with one of these big ones like SARS and MERS, you're not going to spread it because you're not going to spread it that much. We can develop containment much better. But for these diseases like Spanish flu and now SARS-CoV-2 or COVID-19 or the coronavirus, people are spreading it for days to weeks before they even know that they have disease. They spread. That's why they kill more people. So killing a lot, having a higher mortality rate is not necessarily is not necessarily an indication that it's going to kill more people, because you got to spread it before it kills people. Dragonfly 111 cute. We have church online. Yes, I wish we actually do. I'm just asking that we use it. We don't have Sunday school online yet, and I'm suggesting, you know what? I live on YouTube. We could do this online in a heartbeat, guys. Not getting a lot of takers yet, but thank you for that point, Dragonfly. Again, I'm getting my nose points in. Well, I'll leave that alone. Farak Far from Iran, I think, aren't you? Please close the schools. Don't make the same mistake as Iran did. I live in it. Break the chain of contamination. Stay home. Let me repeat that. And thank you so much, Farouk, Farouk. I'm not sure how you pronounce it, but Farouk lives in Iran. He sent us several messages. He attends quite a bit. And he said, look, in one of his previous messages, he said, yes, it's killing kids. Now, I don't know where he's getting that information from. And clearly, when you look globally, this is not one of those viruses that is routinely killing a lot of kids. But I respect the comment. It makes me a little bit nervous. The bigger thing that I hear from you, Farouk, and that is, look, I'm living in the middle of Iran right now. Go ahead and close your schools. Do it now or do it later. Ronald Lopez, thanks, Dr. Brewer, for your clear-cut description and vivid explanation on COVID-19. Thank you very much, Ronald. Have faith. St. Louis private school had a father-daughter leave quarantine to go to father-daughter dance. The 20-year-old oldest daughter returned from Italy with the virus. I would not send my child back. Have faith. I think you made a good choice. You know what? You can go to another dance later. Good choice. Greg without diabetes. Well, I'm glad you don't have diabetes, Greg. Joe Rogan interview of Michael Osterholm addresses this issue. Very informative. Thank you. Dragonfly 111 Cutie. I live in a retirement area. They've canceled the tennis tournament and postponed Coachella and Stagecoach until October. So glad they did, but it is a huge economic impact on the community. Yes. Well, I mean, take a look at the stock market. It's what, over 20% down now. I'm not an economist, but I have to say, you don't have to be a doc to make comments that have an opinion about medicine. And I'm not an economist, but I've got an opinion about the economy. The bull market was getting very, very long in the tooth. It was just looking for something to take it down. And what better than a 100-year global pandemic? So email Dr. Brewer, thanks for the info on COVID-19. Just heard they're canceling Coachella next week, living in San Diego community. So there's someone else talking about Coachella. I don't know what Coachella is. Very interesting. Hey, John Panazzo. Hello, Doc. I returned last week from a 2-week cruise to Antarctica. There are many hand sanitizing stations located throughout the ship, and they were required to use before entering the restaurant. Excellent, John. And you know, pardon my earlier comments about the cruises. I've been on them too, and I'm really glad they do have a lot of those hand sanitizing stations. But here's what I think is happening on these cruise ships. I think it's there are problems with either, I think it's hard to contain stuff. When you look at the people that are serving the customers in the cruise, they're in cramped quarters. Have you ever toured those quarters? Not so great for isolation. These folks tend to not be very wealthy. They tend to have not so good benefits. They tend to be, you know, they've been sick before and ignored it and gone to work. And those are the guys that are preparing your food. And I would say that is a major, major gap in a whole lot of those cruises. The bigger the cruise, the bigger the gap. John Panazzo, by the way, Antarctica was spectacular. Oh, I bet it was. I'm jealous. I'd love to go there. But I doubt we're going to be taking any cruises there anytime soon. I'm the boss. That's the title here. Prevention is key. We can stand to lose some money and time at work, but not lives. You know what? I think I tend to agree. But again, I'm not in the position of making this decision for everybody. Greg, without diabetes, it's airborne, exclamation, exclamation. I know it's airborne, Greg. I'd return that challenge though. There's a lot of things that are airborne that really transmit more by hand to mouth. You know, even though you may breathe out a droplet, it settles on a surface and people pick it up on their hand, touch their face. And here's the thing. I don't know that by the time we figure out how much of this disease is being transmitted hand to mouth, which includes air droplet to surface to hand to mouth, and how much of it's just I breathe in the air droplet that you breathed out. Those are two critical differences. I get you. My point though is, and both are going on. My point is, by the time we figure out how much of it's hand to mouth and how much of it's mouth to mouth or breathing, it won't matter. So, Richard R., are you familiar with NDM1 and are there any similarities between? I'm not familiar with NDM1, sorry. Dragonfly, their concert festivals over several weekends with lots of people from all over the world. I'm involved in an event. We're having an event in Western Ohio, and I placed a call to Mark, one of my co-organizers, and said, you know, we may not be able to have this event. I think it's too early to decide yet because it's over a month away. But we need to have a plan. C. Lear, spring break for most schools is a few weeks away. If kids are not at high risk, why close? Because kids are, it's a population dynamics thing. I mean, if you look at the maps, we want to slow the spread, and we're not delaying the inevitable. We talked about that recently. Tony Fauci at the NIH, Salazar, the Secretary of HHS, epidemic modelers, all have said the same thing. Slowing this thing down, the transmission for it, is not delaying the inevitable. What it is doing is allowing us to marshal our resources, get organized, figure out what we need to do to fight it. So it is very helpful to slow it down. And it's not a waste of effort. It's not delaying the inevitable. Let me read the rest of your point. If kids are not at high risk, why close? If you close the schools, kids will be home with grandparents and have more opportunity to give them virus. I do think that is a concern. A very valid point on that side. And again, I'm glad I don't have to make this decision. I'm glad I'm not a school administrator. Janice was an educator. Her father was a superintendent of schools. Her grandmother was a Dunkard in Pennsylvania. Her son went to a university nearby. This was about 1918 because he caught Spanish flu. The first time Janice's grandmother left home, she had to get on a train and go to the university and get her son with Spanish flu and bring him home. An interesting story. She told me I should tell it on the YouTube, but I said, it's not my family. I don't know the details. You need to tell it. So I'm giving you a summary. I don't know if she's going to tell it or not. Here we go. Ian Stern, better to do the containment now when it can be handled rather than deal with it later. That's what, well, gosh, I'm blanking on your name again. The gentleman from Iran. That's what he said. That's what all of the folks that deal in the high risk, the high experience areas, the areas that have much. I'm sorry. Farouk, yes, thank you. Farouk, that's what Farouk is saying. Don't wait until it's too late. You're going to have to close anyway. So, Soundtrack TV, and then we'll close on out. I have a basic labs checkup with my school doctor tomorrow, and there's CV in my school. I think CV in my school. Maybe you're talking about the virus. Should I still go to this appointment? Would you go? No, I wouldn't. I'm holed up in my apartment as much as I can. I'm fortunate. I'm a retired old man, so I can do that. But I think we need to be looking hard at places where we expose ourselves to the public for their sake as well as ours, especially the baby boomers, especially the people that watch this channel, because guess who? Who are the people that are being killed by SARS-CoV-2? 59 and above, diabetes, heart disease, and if you've heard it once from me, you've heard it 1,000 times. If you don't, you've got diabetes. Think again. The US, the CDC said 1/3 of adults have diabetes, and 80 million adults have diabetes in the US, 72 million don't know it. So if you're over 50, you probably have significant prediabetes and don't know it. Then they decided, there's debate with them right now to change that because I think they're wrong. Not because I think they're wrong. They know they're wrong. I know they're wrong. And it came from UCLA. UCLA said, look, it's not 1/3 of our adults. It's over a half. And guess what? It's not 60-year-olds and above. It's 30-year-olds and above. Prediabetes, which is the same disease as diabetes, except in a lesser degree. Prediabetes is far more prevalent than we're giving it credit. We just don't get it regarding the prediabetes epidemic that's going on. None of these things are huge. I mean, there's nothing to panic about either with prediabetes or with COVID-19, but we just need to be aware and respond appropriately and prevent rather than trying to get a treatment. Okay, Kelly Clover, closing down all the schools is overkill. We can't shut down civilization out of our fears. Thank you very much, Kelly. C. Lear, my sister-in-law substituted at school yesterday and said every time a student sneezed, all the other students sanitized their hands. What about air travel? Air travel for seniors. If I were a senior or a junior, I'd think twice about traveling. And sorry, Kelly, and to others of you who are saying, Brewer, you're overreacting. Again, I don't think there's any need for panic. I just do think there's a need to reassess the need for social exposure right now. Thank you so much for your interest.